Hello guys, I hope everyone are safe and sound. Today in this video, we are going to present about how to manage a food service during an emergency or an outbreak. In this video, we are reviewing the content on what is an outbreak, how it affects the food industry, how to develop new strategies, and who can help. The ongoing pandemic COVID-19 has seriously affected number of lives throughout the world. In this scenario, we need a major plan to cope up with these issues. A pandemic is an epidemic that affects a large number of people by crossing the international boundaries. So, what are the issues due to this pandemic? Supply chain and product shortages, disruption in transportation, medical services, communications, risk of infection in facilities, fewer visits to establishments, and increased basket size. What causes these issues? Staff shortage, lack of a separate set of standardized protocol of operations during emergency, no backup strategies to meet product shortages, no emergency communication systems. Who all are affected with this pandemic? Residents at retirement homes or long-term care homes with compromised immune systems, staff in the food service facilities, and all essential workers. These four steps are to make all the staff in food establishments aware about how to reduce the risk of infection in a food service. First and foremost, be healthy, be clean. Stay home. Wash and sanitize your hands frequently. Use personal protective equipments. Clean and disinfect your surroundings. Practice social distancing. Choose pickup and delivery options. Every staff or person should get a temperature check while getting in and off the work. If you have an elevated body temperature of 38 degrees Celsius or any other symptoms, you are advised to stay home and self-isolate for 14 days. The employees will also be asked to fill out a questionnaire to make sure he or she hasn't been in contact with any affected people. All the staff, employees, residents, customers, clients, vendors, delivery staff, etc., are advised to wash and sanitize their hands as per the procedure. In long-term care or retirement home, all the staff must wear the appropriate protection equipments when dealing with the residents. The staff should wear masks when not within 6 feet distance with the residents. They should wear mask and face shield when within 6 feet distance with the resident. They should be in the full PPE if they are dealing with any residents in isolation. All staff within the establishments are advised to exercise social distancing among themselves as well as the residents.
We have developed a few strategies for food establishment to cope up with the outbreak. One of the major issues is the shortage of staff. Through cross-training and by employing temporary staff, I think we can solve this problem to an extent. For improving the number of customers, we are planning to provide more delivery options and will serve the food in disposable plates and cutleries. Make sure to sanitize all touch points and common areas. While coming to the production part, to avoid shortage of inventories, identify high demand items, and make efficient storage facilities. There will be training for every staff where you can share your concerns with the management team and for effective communication to establish these changes. Attending annual learning program will help to improve your knowledge base too. Here we are going to discuss our activities and goals. There is chances of shortage of staff due to self-isolation or because of transportation problems due to the lockdown procedures. The management have to restrict some staff from job if they are working in other establishments too to avoid the risk. Also, those who are working for a particular time period must take a quarantine period alternated with their working hours. All these procedures can lead to staff shortage in accomplishing daily duties and responsibilities. So our goal is to employ more temporary staff and give training to existing staff in every department for efficient shifting of human resources. This will be done within a month and we will take the performance review within 6 months. There will be an annual employee appreciation program to recognize the employees with outstanding performance after a year. Another activity is to make a complete set of standardized protocol to avoid the risk due to this emergency situation. It will include the mandatory requirements, including screening test for staff that we already discussed in the previous slides, changes in shift hours, changes in food delivery system, and control in customers or visitors by restricting their number to maintain social distancing will come under this. Avoid dine-ins and promote drive-through in restaurants, while in long-term care facilities, isolate each floor and keep more distance between tables in dining room to avoid the risk of spreading. Establish more sanitizing areas for the increased accessibility to the staffs and customers. Make posters in hand washing areas to promote the correct procedures of hand washing. All checklists, which include cleaning, refilling of hand wash and sanitizers, data collected during screening of staff before entering to the shift, personal protection equipment usage records, are all reviewed to identify the need of changes or additional requirements. The changes or improvements to the existing protocol will be made after annual review. An updated protocol will be published after the verification of public health units. The another important thing is to conduct the inventory analysis. The inventory analysis should be done to identify and pre-order high demand items. This should be done within a month. Usage analysis checklist must be reviewed to make decision on what items to buy, when to buy, and how much to buy next time for the smooth running of the food service system. The strategy is to develop and maintain additional storage areas, which include refrigerator storage, dry storage, equipment and chemical storage areas during an emergency situation, and strategies for reducing cost of production are all implemented after a year. Establishing a good communication platform is necessary to manage all the activities and to reach the specific goals. The online learning platform and communication tool will be introduced to every staff within a month, and based on the feedback, additional modules or contents will be incorporated for the improving awareness and to keep updating the skills of employees to new technologies.
So far, we have discussed about the methods and strategies to overcome the crisis and to achieve the organizational goals and objectives. All these goals and strategies should be made effective for a longer period or anytime in the future. So all the short-term, long-term and intermediate goals should be achieved within the time frame. All the goals should be evaluated in order to determine its efficiency. In order to fulfill this amidst the ongoing pandemic and to avoid any chance of risk in future, we will need some inputs to achieve these goals within the time and to receive best results. We will need inputs like staff, one, new technology, time, volunteers, and even more efforts of the staff. We can get additional support from Public Health Unit, Ministry of LTC, medical staff, clients, customers, volunteers, residents, as well as the family of residents. Some other factors that might affect accomplishment of these goals are personal habits of staff, any unavoidable chance of risk such as hospital emergencies. So these are some assumptions during the pandemic chain, such as all participants strictly follow the codes and conduct to meet the standards of the establishment. Everyone get used to the communication platform and utilize it for contacting the other staff or the management team. All cleaning procedures, including sanitizing and disinfecting, are carried out and recorded to minimize any chance of risk. Employees complete their learning program and receive their additional pay within the time frame. This in short, I'm going to tell you that if government can do anything for us for the betterment of our lives, it is also our responsibility, our duty to give them something for betterment of this country, of this city, as well as the world. So we need to follow the strict standards, the cleaning procedures, as well as the communication during this pandemic.
This handout is provided to all the employees and staff, and they are advised to follow these steps when they come in and get out from the work.
Wash and sanitize your hands when you come in for work. Wear the mask. Get your temperature checked. Wear a mask and face shield when within 6 feet distance with a resident. Put on full personal protection equipment when in contact with people on isolation. Proper donning and doffing should be performed. Repeat steps 1 and 3 when you leave the work.
In nutshell, COVID-19 is a health crisis, but it could also lead to a food security crisis if proper measures are not taken. The world is already facing food and nutrition security challenges. According to the United Nations Food and Agriculture Organization, more than 820 million people across the globe are already suffering from hunger. Thus, now it's our time to give something to the world, to the government, by giving our input such as more and more staffs, more and more volunteering, more and more funds, as well as if government are doing something for us, they are introducing the international market as well as a food supplies change through many agents as well as a health unit, then now it's our turn to give something by following proper standards to clean and sanitize equipments, maintain social distancing, and stay at home. So stay safe and stay at home, guys. Thank you so much.